All right, good morning, Labor, Health, and Social Services Committee for our second meeting of the 2024 year. We do have three bills before us this morning. Before we jump into those, we'll have Barb call the roll.
Representative Chadwick. Representative Austin.
Here.
Representative Hornock.
Here.
Representative O'Hearn.
Here.
Representative Penn.
Here.
Representative Trujillo.
Here.
Representative Ward.
Here.
Representative Yin.
Here.
Chairman Zwanitzer.
Here.
Thank you.
All accounted for. First bill this morning, unless anybody has any opening business or comments, just making sure. House Bill 24, the Certificate of Need repeal. We spent some time on this in the interim committee. And so I'll bring the Director of Health up just so he can maybe give us a very cursory overview of what the change from approval to comment means and taking that approval away. He brought as well. Welcome, Director. I'll give you the floor if you'd like. The committee spent 3 meetings, I believe, on this in the interim, so we're kind of familiar, but if you'd maybe just walk us through the repealers as well and what they might mean to the Department of Health.
Thank you, Mr. Chairman, members of the committee, Stephen Johansson with the Wyoming Department of Health. At your request, I'll walk through the bill. This was not something the department brought to the committee. We do not have an issue with repealing the Certificate of Need, but as we discussed at a couple of the committee meetings during the interim, there's pros and cons to having the Certificate of Need in place. There's pros and cons to not having the Certificate of Need in place. Just by way of background, very quick introduction, the Certificate of Need was put in place for long-term care facilities many, many years ago, really all over the country. And the idea was to ensure in certain geographic areas that long-term care bed capacity was not outgrowing demand, meaning if you look at the Certificate of Need statute in Wyoming, in a 30-mile radius, so to speak, if the occupancy of all nursing facility beds is below 85%, then there's a limit on new nursing home bed construction. That's a legislative action, again, many years ago, enforced through the Department of Health, through our Office of Healthcare Licensing and Survey, which Miss Laura Hudspeth to my right oversees in the director's office. The intent for Certificate of Needs legislation all over the country is again, there's a few mechanisms that it's trying to or that they try to put in place. One, as I mentioned, is to make sure that bed supply does not outstrip the demand. And part of that is because there is public payers like Wyoming Medicaid, for example, are major players in the long-term care system. Many folks who require nursing home level of care rely on Medicaid as the pay source. In fact, in Wyoming, 65 to 70% of all nursing home bed days are paid for by Wyoming Medicaid. So again, in theory, going back many years all over the country, the idea was to limit, cost on the public payer side while also ensuring that the bed supply in nursing homes is adequate. But as we discussed, as you all discussed during your committee meetings, is it necessary? And there's an interesting discussion there. We do not see a whole lot of requests in the Department of Health on the Certificate of Need, and Laura can go over how many requests we receive, but we discussed that during the interim committee. But again, the Department of Health, if the Certificate of Need were repealed, we're neutral on the issue. We don't see a major issue on our end. Going to the bill, Mr. Chairman, it's pretty simple. So you have section 1 on 35-2-906, construction and expansion of facilities and exemptions. This is really, take it in reverse order. This is an amendment that was made during the interim work that I'll speak to second, but section 2 is really where you see the Certificate of Need repeal itself. And that just means that the Department of Health enforcing that sort of geographic bed limitation would now be repealed. The way that we enforce that is if a nursing facility is planning to construct new beds or expand, we review per the statute that geographic area. that's articulated in statute. And then we determine what the occupancy of all nursing home beds in that area is. If it's less than 85%, then it triggers the limitations that are in that statute, meaning you can only expand up to 10%. There's a few limitations in there, and our office makes a determination, is this expansion approved or not? So that section 2 is relatively simple. The amendment that happened, which you can see in section 1 of the bill, mostly on page 2, lines 4 and lines 6 and 7, you all motioned to change our approval to commenting. From what I remember from the discussion, that was really in line with the certificate of need repeal, saying, well, if the certificate of need is gone, do you need to approve, these types of requests? No, you can comment on them. And the intent, I think, again, we would have no issue with. However, in this section of statute, which is stacked kind of on top of or adjacent to the actual certificate of need language, this deals with all life safety code plan reviews and construction plan reviews. Where there might be an unintended consequence here is that we provide that service not just for nursing homes, but for all licensed healthcare facilities who are planning construction projects. What we do is we take the plan for any sort of project, any sort of expansion, nursing home or otherwise, hospitals, assisted living facilities, boarding homes. We look kind of as a preventive measure for the facility, for the industry, and we look at those plan reviews preliminarily and see if it would meet life safety code and licensure, so that we can tell the facility prior to construction that you will or will not be in compliance. Therefore, we're not doing it after the fact during the licensing survey, if that makes sense. Meaning the facility has done the project and then the hammer of the state comes in and says, no, you don't meet life safety code. You're not in compliance. Now you have to spend additional money on your construction project to fix that issue. So we have, I know there's probably a proposed amendment you'll hear about within this section to clean it up a little bit and ensure that this action is really only related to the certificate of need. We would certainly support that, Mr. Chairman and members of the committee. But again, like I mentioned, the Department of Health really does not have an issue with the certificate of need repeal. We will stop doing that if the legislature so directs, and would be happy to report back to this committee regularly, periodically on how that's going. With that, Mr. Chairman, happy to stand for any questions.
We'll turn it over because I have some questions from Ms. Hudspeth. Before then, Barb, there may be an amendment. I think we did get all this one over email last night, but we don't see it up here, our dais. So if you might check your email and see if there was an amendment that LSO provided on House Bill 24, and it might have come at 5:30 last night again. And make some copies for the committee. That would be great. All right. With that, Ms. Hudspeth, welcome. Always a pleasure seeing you. Can you give us maybe some data or an idea of how much time your office spends on preliminary work and consulting and checking, and how much of an FTE perhaps?
Mr. Chairman, members of the committee, we have 3 full-time engineers who are very busy. We average about 75 projects a year, and they're full-time. They do the plan reviews, they do inspections, and they also do life safety code surveys on behalf of the Centers for Medicare and Medicaid Services, as well as emergency preparedness surveys. So again, we have 3 full-time engineers.
And pardon my ignorance, these are state employees who hold engineering professional certification degrees that work for the Department of Health.
That's correct.
Mr. Chairman. Go ahead, Representative O'Hearn.
Thank you, Mr. Chairman. How long does that plan review normally take? I was reading through this, and as an engineer, or not an engineer, but a building official, I have to do plans review all the time. And I wanted to add something to this, depending on your answer. How long does that normally take?
Mr. Chairman, Representative O'Hearn, we have, our engineers are very focused. And if we have a major project, for example, a new hospital, which is a very extensive plan review, they split all the codes up. And I would imagine, I don't have the exact data, but I would imagine within 3 to 4 months at the most is the timeline.
Representative Chadwick?
And Mr. Chairman, if I may.
Go ahead, Director.
To add Representative Ahern to what Ms. Hudspeth mentioned, it really is project dependent.
Mhm.
So as she said, kind of on the extreme end, if you have a new hospital like has been planned for, Sublette County, has been constructed in Saratoga, those can be much more involved as a preliminary review because there's so many elements to it. But we also get requests for, sort of minor construction projects,
Mhm.
very minor expansions that are much quicker.
Yes.
Now Representative Chadwick.
Thank you, Mr. Chairman. So, Ms. Hudspeth, what effect do you see the appeal of this having on your three engineers? Does it just mean less work? You're gonna have to let somebody go, et cetera?
Mr. Chairman, Representative Chadwick, I could see where it could have considerable impact. I do want to mention, that there's another section of a statute that gives the department authority over all aspects of construction, except for electrical, which is the fire marshal's office. So there's a conflict with that. But it could have considerable implications if plan review and inspections were not required, certainly on FTEs, but also in terms of a safe healthcare facility in the end, in terms of fire safety, infection prevention, adequate space for quick response in the event of emergency. So the building is a incredibly important component to a safe healthcare facility.
And Mr. Chairman, Representative Chadwick, again, sorry to keep putting cherries on the sundae here, but to add to that, I want to be clear that Section 2, which is the repealer, is simple. And I think there's more minimal impacts, I think, to department work other than we just don't review certificate of need requests anymore because the certificate of need law is gone. It's really Section 2, this amendment, that I think there may be some unintended consequences of broadening the scope where these preliminary construction plan reviews and approvals, being changed, that has a broader impact. We just want the committee to know there's a broader impact than just certificate of need for nursing homes. There's a broader impact on that review for hospital construction projects, assisted living facility construction projects, et cetera, where we have pretty detailed requirements from the legislature and statute to review things related to life safety and those elements. So really two things to answer your question. As I mentioned before, on the certificate of need repeal, your Department of Health is good. I don't want you to hear, major opposition or unintended consequences we're bringing. It's that small change in Section 2 that from my perspective, and I may be wrong, was intended to align with the certificate of need repeal in Section 3 for nursing facilities. It's just broader than that, given the work we do for the larger industry.
So let me ask a follow-up on that then. You would still have the ultimate reviewing authority for approval upon the build, construction, design at the end of the day. With this, if a bill goes through as is, you're just not doing that preliminary conversation, making sure everything's going well along the way, but you still have the ultimate at the end of the day. So we're really just placing, I guess we'll call it a burden on the industry to make sure they're doing everything right and correct, at risk of you coming in and saying, you've done this wrong. Now it's a $2 million change order to come back and make sure that vent system is more appropriate. So it is somewhat of a public service as we're building to ensure step by step. But if not, it would just require a heck of a lot more expertise, oversight, and work on behalf of the contractor of the project. Does that seem fair? Or am I putting that too simply? But you're still the ultimate reviewer. It just depends if the
Yeah.
likelihood, if people run the risk of doing inappropriate work, of you coming in and saying, do it again.
Mr. Chairman, that's correct. I think that changing the verbiage from approval to comment makes it unclear in terms of our authority to ensure on the preliminary plan reviews and the final plan reviews that everything is being constructed correctly. So if we're just commenting, I think it questions our authority throughout the process to ensure that when the building is finally constructed that it meets all codes in order to be licensed and then certified by Medicare and Medicaid.
Austin.
Thank you, Mr. Chairman. To either one of you, do you know what is our availability of nursing home beds? Like, do we have a shortage and that's why this is pressing right now? Or there are quite a few beds available? And then my second question, I just had some notes. It said free market versus the situation of staffing in Buffalo. So if you could maybe address what your remembrance on that part of our earlier conversation was as well.
Go ahead, Director.
Mr. Chairman, Representative Clouston, it's a good question. I'll defer mostly to Laura on some of the data you brought up on our general occupancy. It varies community to community. And I think in general, with respect to the certificate of need, as we discussed at our committee meetings, you have the situation where in certain areas, the certificate of need could prevent, the addition or an expansion of a facility that's very high quality and has a long waiting list, because an adjacent facility down the road that may be lower quality and not have a waiting list and have beds available is not as in demand from the public. So we totally understand from that perspective of, a market mechanism that's being thwarted. But on the other side of that coin, I think you would hear from facilities or communities that the certificate of need is beneficial because it protects a high quality facility from, other market entrants. But again, is that the role of the state? Is that appropriate? What you guys discussed over the interim is relevant here. But in terms of occupancy statewide, it really does vary. And I'll ask Laura to give you a general picture, but we're happy to follow up with specific occupancy data.
Ms. Hudspeth.
Yes, Mr. Chairman, Representative Clausen, we currently have 36 nursing homes. The highest occupancy rate is 86%. There's only one nursing home at 86%. The lowest is 53%, and the average for the state is 70% occupancy.
And Mr. Chairman, Representative Clouston, you had asked a second question on Buffalo, I believe. Could you repeat that for me, please?
Thank you, Mr. Chairman. Yeah, just in my notes, it was referenced opening was it a veterans nursing home in Buffalo, and then some of the staffing shortages that caused at both facilities.
Mr. Chairman, Representative Clouston, yes. So the legislature authorized and we constructed a new nursing facility on the campus of the Veterans Home in Buffalo over the past several years. We opened the first cottage of that facility late in 2023. For those of you who haven't seen it or weren't there for the opening, wonderful facility built in greenhouse model. Seeing the veterans in that facility was a great honor for me, and I think the level of care that's there is very high quality. But you're right, we have the reason all three cottages are not open is because we have significant staffing issues, which is not unique to the Department of Health. That's across the industry and certainly across long-term care in the state. So we are working to staff those facilities up. But in terms of the labor shortages we're seeing, especially on the direct care side with CNAs and with nurses, is very significant. And I do think that statewide issue of staffing plays into this policy decision as well what would happen if the certificate of need is repealed. We can't tell you with a crystal ball. Will you see a ton of expansion of long-term care facilities or new market entrants coming to the state to build? I don't know. I don't think it would be extremely rapid in the short term, primarily because the industry is struggling so much to staff those beds. As Laura mentioned, with the statewide average of 70% occupancy, you can see just by those numbers, we have nursing facilities all over the state that would have beds to offer to meet the demand of folks who need that service, but simply can't have the adequate number of staff to provide that service.
Get my mic. Representative Hornock.
Chairman, I have a couple of questions. Does the health department currently have to abide by certificate of need? Do you have to file for a certificate of need for state funded health department projects?
Mr. Chairman, Representative Hornog, no, state facilities are exempted from that. The intent going back years, I probably couldn't tell you. I wasn't part of those discussions, but if I had to guess, would be our facilities are generally pretty specific or specific to populations that the state has missioned us, for lack of a better term, to serve. Obviously, on the certificate of need side, it's related to long-term care. We operate 3 nursing facilities. I'll read those out to you. We mentioned the Veterans Home in Buffalo. That is very specific to veteran services. We're the only facility, both on the assisted living side in Buffalo and now the nursing home side, that provides that level of care just specifically to veterans. So that pretty specific facility and regulated both by the state. The nursing home will have a CMS Medicare Medicaid component, as well as both campuses on Buffalo, are overseen in certain areas by the VA. We have a state-run nursing facility in Basin, Wyoming, approximately an 85-bed facility nursing home in Basin. That is more general in its mission, but we do take a significant portion in that facility of residents with psychological, psychiatric, mental health, memory care issues, even clients that need to discharge from the state hospital, for example, but we can't find a long-term care facility in the state or the country that will accept them. We'll often try to leverage the Basin facility. And then last, but certainly not least, this is relatively new, the campus in Lander, the Life Resource Center, which historically was what we call an intermediate care facility for folks with developmental disabilities, acquired brain injuries. You all changed that mission years ago, I think for the better, to be somewhat of a companion or sister facility to the state hospital, to not only serve folks with developmental and intellectual disabilities, but also the quote unquote hard to place populations and extreme significant behaviors, comorbid diagnosis, dual diagnosis, et cetera. One of those populations, as I mentioned at the state hospital, we have long-term patients there that really aren't in need of acute psychiatric stabilization anymore, really just need a long-term care setting or nursing care services in addition to, their mental health. But private sector and other facilities either can't or won't accept those patients. So the state constructed a nursing facility level of care at Lander, the Life Resource Center, to be able to provide that service. And that we moved into that campus, those buildings, a little more than a year ago, about a year and a half ago. So those are the 3 nursing facilities we operate. And again, pretty specific to populations and per state statute would be exempted from certificate of need.
Follow up, go ahead.
Yeah, so the state has some great facilities. And none of them, if I understand, needed to go through this certificate of need process. So we're only talking about private facilities. You mentioned, it was mentioned the engineer side of things. Do the engineers you have on staff go through this same review process with those facilities that you talked about, with state-run facilities, with state-sponsored healthcare facilities?
Mr. Chairman, Representative Hornok, good question. And the answer is yes. On all construction life safety, we would be licensed healthcare facilities that would be subject both on the state side and the federal side if you're billing Medicare or Medicaid to those requirements. So with construction, with life safety, with survey, we absolutely go through that and are subject to those requirements.
Yeah. So in that review process, I imagine that you also review private companies that come in. They have to submit their plans to you, so that the state engineers will continue some of their work on the state side. And if we leave this bill as it is, as amended in the interim, you will still go through that plan review process with plans that are submitted, and you will still comment on them. How closely do you work, well, first, where are these engineers located in the state? So I imagine they're centrally located somewhere, so they travel throughout the state. It's quite a burden on those engineers, I imagine. And then I imagine you also work with existing municipalities, with existing, the cities, the counties have their own plan review process. They check those plans for code compliance, for life safety issues, and then you also have the life safety element of electrical plan and design, fire life safety type of things. Those are still in the mix in all this process. So that stuff, we're not talking about any of that stuff going away. What I'd like to know is how closely you work with all of those other plan review entities in the coordination of a design review, so that, and how closely they work with you so that the facility that's being designed by a licensed engineer, by licensed architects, abides by all of the codes that are out there pertaining to life safety and building health environment and walls not falling down. So just some questions there.
All that, Director.
Mr. Chairman, Representative Hornock, I'll answer generally and kick it to Laura for some detail. We work very closely with the folks that you mentioned, and there's just frustratingly, both to the industry and to us, there's differing standards depending on the authority that is at play. So, local ordinances, things like that would not be things we are reviewing and enforcing. We're really looking at what the state has established as, life safety code for healthcare facilities that we license, as well as provisions that would be required if the facility, whether it's a nursing home or a hospital, is enrolling as a provider in a federal program like Medicare or Medicaid, and there are requirements there, both on the physical plant side and the service delivery side. So I would say we work closely with those folks. And to answer your first question, most of our employees in the Office of Healthcare Licensing and Survey, it's a small office here in Cheyenne. Those engineers, as you mentioned, are on the road a lot. Those are tough positions to fill at that high level of certification and knowledge, but also the travel that's involved, and they're out in the field constantly. Outside of the engineer and plan review type staff, we also have surveyors that on the back end, when a facility is complete or when a facility is operational and surveys are required, we have staff that both are located here in Cheyenne, and sometimes if we can fill them and keep them located more centrally out in the field where that travel time is minimized. Laura, anything you'd like to add there?
Yes, Mr. Chairman, Representative Hornick, we have 3 engineers, 2 are in Cheyenne, 1 is in Cody, and we do work very closely with the local municipalities. But I think our authority is more on the healthcare side, and they don't have that expertise. So we focus on the codes, the healthcare portion of the codes, since we have authority over the healthcare facilities and they do not. But we coordinate, with the fire marshal's office and DEQ in terms of asbestos. We do a lot of coordination on these buildings.
Okay, Representative Clausen.
Thank you, Mr. Chairman. Follow-up question is, as far as this has a 30-mile radius, I believe, on it with a certificate of need. My thought is 30 minutes, if I want to go see my dad every day, is a long ways to travel each way. Does anything else in the statute, if we change this, my thought is if we had a 15-mile radius, and we were talking about some of these other unintended consequences, does that affect some of the other hospitals, clinics, other things that we're talking about?
I'll believe he'll hear that in a bit, but if not, Director Johansson.
Mr. Chairman, Representative Clauston, very briefly, again, not to frustrate the committee, it varies. You have communities that have nursing homes that might be less than 5 miles apart. And so that 30-mile radius that was originally established in statute a long time ago, I think is meant for more of a geographic region than a locality. But it really, again, as you know, it varies where you might have a community or, Rock Springs, Green River, for example, where there's a bit more distance, but might be in the 15 to 20 mile range, but not over 30, those types of things. So I'm not sure if that answers your question. It really is pretty variable.
Other questions for the department at this time? Don't go too far. Mr. Lindholm, do you want up next? You just look like you were ready to jump out of that chair. There's no other agent, Medicaid, no thoughts on this one? Okay, making sure I got all the agencies first. Not seeing any other agencies. Welcome.
Yeah, thank you, Mr. Chairman. If I could, I'll let my colleague, Ms. Womack, kind of kick the ball here and
Welcome, Amy. Or if you'd still state your name and who you're with.
Mr. Chairman and members of the committee, I'm Amy Womack with Americans for Prosperity, Wyoming. We are on and in favor of this legislation, specifically for breaking down barriers for individuals and their loved ones seeking care at the long-term care facility of their choice. Thank you.
Follow up, Mr. Lindholm.
yeah, thank you, Mr. Chairman and members of the committee. I do want to touch on some of the amendment language that you've recently seen. I was able to have a really good conversation. I'm certainly not going to speak for the Hospital Association, but in looking at that comment language in the top portion, our concern there, I think, is much along the same lines as many of yours, that we don't really necessarily believe that certificate of need serves its purpose that it was originally set out to do. And as long as we're not violating the Wyoming Department of Health's health and safety codes that they have to live up to, and we can still get rid of certificate of need, then that serves the intent and the purpose that I think this committee was at. So we're okay with, as far as Americans for Prosperity, as far as if you chose, Mr. Chairman and members of the committee, to amend that language, I think it meets that intent. We're still in favor of all your repealers that you've got in there. We think they're great. And just to go through those really quick, the government exemption under G, that was talked about by Representative Hornock, and he's absolutely spot on. None of this applies to government-run facilities. Inequity. So absolutely get rid of that. I think that's great. F, the exemption for a pilot program. Don't believe anybody's using that pilot program anymore. So your stance there is pretty fantastic of cleaning up statutes. And then C, the 10% or 10 beds. We heard from the Wyoming Department of Health that your average across the state is that 70% right now. So that means that they can expand up to 10% every 2 years without seeking approval from the state government. We think that's an inappropriate use of the state government, and they shouldn't be necessarily directing these entities on how much they can expand. The free market decides that, in essence, is our stance on that. And then B, the 85% rule. Once again, hearkening back to what the Wyoming Department of Health just testified to, that means that one facility in the state of Wyoming would meet the standard. One facility. As we know, there's a lot of people moving into the state of Wyoming, and particularly in my area where I'm from, up in the northeast corner of the state, we're seeing a lot of retirees move in. So all of a sudden, that 85%, I believe Crook County Memorial right now is probably in the neighborhood of the 60% right now, but that could jump in 10 years to be fully at capacity. And as you know, long-term care facilities take a little bit of time to build up. So we're in favor of that repealer also. And then the 30-mile constraint under 352901A5, removing that barrier of 30 miles. My little neck of the woods has multiple towns that are within that 30 miles, some of which are in South Dakota. Now, granted, that would lean on the federal law of 35 miles. We would still be constrained by that in Little Oak Crook County, Wyoming. I don't know about you, but Mr. Chairman and members of the committee, but I would, if I end up in a long-term care facility, I damn sure would want to be in Wyoming and not South Dakota. Everything against South Dakota. Also, Mr. Chairman, members of the committee, I did want to talk about the history a little bit of con laws and where these come from. They were originally put in place in New York in the 1960s, and their original intent was to constrain healthcare costs because for some reason in the 1960s they thought limiting the supply of something would limit the cost. As we know about basic economics, that is not the case. Supply and demand is what drives our economy, and more beds tends to constrain the cost of things. And that's why in 1982, the federal government put a mandate in that states adopt con laws, and it only took them 5 years to repeal that law, realizing that con laws were not effective. The federal government realized this in 1987 when they repealed that mandate. This is the last little piece of con laws in the state of Wyoming, and it's only for long-term care facilities. And we support a full repeal so that Wyoming no longer is constrained like the federal government is. Mr. Chairman, this might be the broken clock situation where they're right this one time.
The twice a day analogy that, okay, got it. Representative Hornock.
Thank you, Mr. Chairman, Mr. Lindholm. So, years ago in my construction work, I worked for a private company that built these really beautiful long-term care facilities, but they were extremely limited on the amount of beds they could provide, where they could provide this service. And so I, have a little bit of a kind of a personal history with this, seeing those constraints put on a private company that wanted to come in and provide a very valuable service. Do you know of instances in the state where that has specifically happened? And then if we repeal, if this law goes into place, I guess we're shooting in the dark a little bit, but do you know of any circumstances where there are companies that would be glad to come in and provide some of this service, even competing for individuals where one facility provides certain services, one facility provides different services, just, that competition in the market, all of that stuff. Do you know of situations in Wyoming where that would happen? Thanks.
Go ahead.
Yeah, thank you, Mr. Chairman, members of the committee. As far as the constraints, that is, I think, I would like to find out if at any point the Wyoming Department of Health has ever denied. Because if so, I think that's a great opportunity to point at the fact that we don't need con laws. If they have ever denied, I think that's also a great point by which we don't need con laws and we should repeal. So both. But I don't know specifics in that regard. As far as expanding capacity, I do know, and this is just from my own personal experience in my own little neck of the woods, that there's been a lot of talk as far as expanding up in Hewlett, Wyoming, and putting in a long-term care facility up in that area right at the base of Devil's Tower. There's been some private action up there as far as putting a new clinic and those types of things, but they are concerned because they are within that mile limitation of Sundance, Wyoming. So there is concern there. As far as whether they've ever gone after it, I couldn't say, Mr. Chairman, and to Representative Hornock's question, I'm not entirely certain.
Further questions? Or you're also with Americans for Prosperity?
Oh, Mr. Chairman, I'm sorry. State Director with Americans for Prosperity, Wyoming.
Just making sure. No other questions at this time? Thank you much.
Thank you, Mr. Chairman.
Other people wish to speak for, against, or on the bill? Come on down. I think there's probably a couple of people more to speak, but nobody else wants to be first. Welcome, Mr. Bully.
Thanks, Mr. Chairman, committee members. Eric Bully, president of Leading Age Wyoming, and also the Wyoming Hospital Association. And I wasn't sure the hospital association was going to get sucked into this until you made this final motion at the end of the Saratoga meeting to drag hospitals into it. I think first I'd like to address what Director Johansson has already talked about, what Mr. Lindholm talked about. When it comes to approval or comments on construction projects, we oppose the amendment. We actually, as an industry, want to leave this the way that it is, or I've submitted some alternative language. I passed out an amendment to potentially fix that. This is a safety net for any of us that are building healthcare facilities in our state, and it can save us millions and millions of dollars. It can expedite our ability to open our facilities or our new constructed areas. We actually favor keeping the approval in place. And as has been discussed here today, life safety, healthcare life safety is different than other construction projects around the state. And we want to go into it to make sure when our construction's done, we can go through our final survey and we can open the doors and start using those spaces. The last thing we want to do is to have an outside contractor or inspector think that they're in compliance with the right codes, which a lot of times they are not. And then we end up with a huge change order at the end that will cost us millions more dollars. So I would ask you to either consider the amended language that I passed around, and it doesn't have a title on it, but it's highlighted in red. That's the one, yeah. Or leave it the way that it is, and take comment out and just leave approval. And I'd be happy to answer any questions on that before I start talking about the rest of the bill.
Questions currently? Representative Clouston.
Thank you, Mr. Chairman. Mr. Boley, just on the bottom talks about draft language with the sunset provision, 2 to 4 years. If you just want to maybe address where that came from and what your thoughts were behind that sunset provision.
Mr. Billy.
Yeah, Mr. Chairman, Representative Clouston, thank you. In conversations with Mr. Lindholm, I don't know what this is gonna do, honestly. I don't know if any of us do if we repeal this thing. I have some concerns, honestly, and I actually agree with some of what Mr. Lindholm said on some of the repeals. I think it makes sense to come back to this in a few years. We've had this in place for a long time. And I'd like to spend a little bit of time talking about long-term care because we really haven't done that. But I think just coming back to it, sunsetting it, and then having another conversation about this in 3 or 4 years makes some sense. We'd have some data to see if this has improved access, if we've seen new construction, if this has made any difference at all. And then at that point, I think we have if we want to repeal it for good, that's great. If not, if we need to do something, it gives us the opportunity to have that conversation.
Representative Pornock.
Mr. Boley, question for you. So you represent the hospital association, and does the hospital association that you represent have any of these long-term care facilities in a certain market, various markets across the state, various municipalities and places across the state, that by removing this certificate of need, might find that there will be companies coming in building close to your existing facility, thus giving you some competition? Thank you.
Go ahead, Mr. Billy.
Mr. Chairman, Representative Hornick, I do represent the hospitals. I also represent about 2/3, if not more, of the nursing homes in the state. We do have, I think about 10 of our hospitals do have nursing homes. Actually, the new one in Saratoga that was just built has a nursing home attached. And there's some history there we should talk about before we go forward. But yeah, we do. As far as competition, I don't know. There may be certain markets that are attractive. There may be, most of them aren't, honestly. We just had one of our hospitals that had a nursing home attached in Basin that closed its nursing home because they can't afford to keep it open. In most situations in our state where the hospital has a nursing home attached, they're subsidizing it. In Gillette, I've heard it's multi-million dollars a year to keep that one open. The one that I used to run in Kemmer, we opened it because there was a need in our community and nobody wanted to come in and open it. So we passed bond elections, we paid that back and we built it and we were subsidizing it. And so it's all over the board, but yeah, there may be certain areas that it could potentially impact. And you know, as we look at that 30-mile radius, it's very specific in there where it talks about existing hospitals or existing nursing homes or hospitals that have swing beds. Swing beds, a swing bed patient is someone that needs skilled care. A lot of our nursing homes are structured that are attached to our hospitals so that the skilled care takes place within the hospital. And that's what helps keep those hospitals afloat, alive, the swing bed patients. And then the nursing homes are licensed for Medicaid and private pay only. So once they've transitioned from skilled care, then they'll enter our nursing homes. So that's why that provision is in there. And it's to help make sure that in communities that none of you live in, that those critical access hospitals stay in existence and continue to serve those patients.
Another one?
Just to follow up, so don't get me wrong, you provide a extremely valuable service that's highly appreciated in markets currently that I understand it may be very difficult to, come. Wyoming's just a very unique animal when it
Yeah.
comes to healthcare. So, but just curious, you mentioned Basin, that you closed the facility in Basin, and then we heard from the health department that they have a pretty large facility in Basin. Do you think that their large facility in Basin was part of the reason that your facility in Basin had to close? Thank you.
Mr. Boley.
Mr.
good luck.
Chairman, Representative Hornick. The Basin facility that the state runs is a safety net facility that our members all across the state rely on. They take patients that most of our nursing homes can't handle. As far as the competition between them and Basin, it may have had a small impact on it. But what we found is that when that facility decided to close, there are certain requirements required before they can close. They have to have safe discharges for all of their residents. And the facility there that is state run, the retirement home, was able to accept some of those, but others had to move 30, 40 miles away to be taken care of. It may have led to it a little bit, but I don't think that's the real reason that facility ended up closing. I just don't think that the economies of scale made sense, and that, as I said, they were subsidizing it. The staffing issues that we're facing across the state right now in long-term care, our state's not really attractive for long-term care, honestly. We don't have the workforce. And I fear that we're going to lose more instead of gain more. There are many of them that are considering whether or not they should stay in business anymore.
Thank you, Mr. Chairman. So some of this repealer is the first one, 35-901, talks about the 30-mile requirement of how close a new facility can be built. I just keep thinking that in the free market, when we have those types of statements in statute, it seems like the free market certainly is dampened by those. When we talk about staffing issues, and a lot of the other things we discussed, I think that if a private company wants to come in and build, then the onus is on them to make sure that their business model is going to be supported by the community, that there's enough staffing in place. And so I have a difficult time trying to prevent someone from failing in the free market and propping them up with statute. And so I support these types of things. I don't know if you have any comment on that, or.
There might have been a question there, unless you want
Would
to
you
comment on
agree?
her support. Go ahead.
Chairman's wanted to represent Penn. I always have comments, obviously. So this notion of free market in healthcare, it has some pitfalls, and I don't really consider, and I know our stance is different. It really isn't free market. There's cherry picking that takes place where people can make money. But when we talk about our hospitals and our core nursing homes in our communities, it's not free market. They're there serving a vulnerable population, normally at great risk. So what I see happening, and this is what we heard from Utah. Utah put a moratorium on their certificate of need. And during that 4-year period, there were skilled nursing facilities that opened and went in and competed against already struggling nursing homes, took Medicare only, which is a much higher payer than Medicaid, hurt many of them. And then a lot of times they turned around and sold those off later on and took a great profit and walked away from it. So in our small communities, and again, I look at this committee, you guys are all lucky. Y'all live in areas where you have big populations, multiple choices, but we look at our small communities where we have a critical access hospital that was voted on and supported by the taxpayers that may open a nursing home to fill a need. To open this up could potentially damage not only them, but the others. we've even seen this work, and I'll use a couple of hospital examples. In Casper several years ago, we had physicians that broke away in the open Mountain View hospital to compete against Wyoming Medical Center. And shortly thereafter, we had another physician-owned hospital, Summit, and then a sister facility built in Rock Springs, Aspen Mountain. They didn't have to follow certificate of need. Both of them really struggled, but what ended up happening is Mountain View operated for a period of time and then made a bunch of money and then turned around and they ended up selling that to the hospital. Summit Medical Center had investors come in, went through a whole bunch of change of ownerships. It just recently sold off and now it's owned by one of the hospitals. That's what I expect will happen, could potentially happen here, is we'll see a trend where they come in and make a whole bunch of money, which is what the American dream is all about, but could potentially hurt those communities. I think another thing that this committee probably doesn't remember, but you need to realize that a failing nursing home could potentially fall on the state to go in and to rescue. And we had that happen not too long ago. In Saratoga and in Rock Springs, there was a management company that owned 2 nursing homes. They went bankrupt and they washed their hands and walked away and left 2 nursing homes with their staffs without pay. The state went in and had to take over both those nursing homes and save them. The nursing home in Saratoga was taken over by another company eventually, which is now transitioned into a community supported hospital that now has that nursing home attached. And the one in Rock Springs was finally taken over, but the state had to run that. The money that is used to run those is money that comes from the existing nursing homes in our state that have to pay civil monetary penalties through their surveys to help fund those. And the state actually has to keep a pool of money that comes from our existing nursing homes in the event that happens. So it's not free market. You can keep saying it is, but this is not free market. This is a different animal altogether, while I understand your stances on those things.
So you might not agree.
Not necessarily, yeah.
And then you said you had other comments as well?
Well, I just think when we talk about the survey process and when we talk about life safety, this is one of the reasons I think it's so important for us. So our nursing homes has to go through an annual survey. Every year we're surveyed, not only for our quality and how we're taking care of our patients, we also have to go through a life safety survey. So so we want to make sure we're in compliance when we open, that we stay in compliance. I think that's why this first section is so important to leave it with approval. It gives us some recourse against the Department of Health. If we follow theirs, it gives us the chance to go back and say, you already approved this. Our critical access hospitals are surveyed 3 times, or every 3 years. It's statutorily, they have to be surveyed 3 years. Our PPS hospitals, our bigger hospitals, they can either elect to have state inspection or a lot of them use Joint Commission and others to come in and do their surveys. So again, this is actually a safety net that we really appreciate, is having that approval process. I can share examples with you too, where at times some of our facilities have tried to use local inspectors, whether it's for electricity, fire marshal and things, where they fall under the municipality or the county codes. They don't fall under life safety. We've had a couple of situations where our folks tried to cut corners. And then when life safety came in, they weren't in compliance with what is required for a hospital facility. It cost them millions of dollars. So I'm just trying to eliminate that, make sure that we get these things done as quickly as possible in the right manner and move forward. There was a question, I think it was Representative Hornock, that asked what bed numbers look like in our state. There's a lot of beds available right now. Most of the nursing homes are running around 60%. There are a few that are doing better in very localized communities. But at 60% occupancy, they're not making money and we're going to lose some. And again, that goes back to staffing. And so if we could find a solution to the staffing issues, which I don't know if we ever will, it would make a big difference to me. I think the 85% that's currently in statute, I don't know where it came from, but realistically, if you consider a nursing home being successful, it takes 85 to 90% occupancy for them to basically break even, especially under the Medicaid private payer mix. And so I think that might be why, it basically ensures that you've got a viable nursing home in the community. It makes sense to put another one in. And with my position, with my long-term care association, I usually get calls from interested people that either want to build assisted living or want to build nursing homes in our state. They call and kind of talk about the climate of the state and things. I've never had anybody call me and say, what does certificate of need say? And I really rarely get any calls. I can't remember the last call about building a new nursing home in our state. I have had a few calls about putting long-term or assisted living in, and we've actually added some assisted living in our state because it doesn't fall under this purview. So I guess in closing, I really don't have any issues with repealing the exemption that already exists for governmental entities, although we've talked about Buffalo and what it did to the already existing nursing home up there. Buffalo Hospital, Johnson County, Amy Holt Care Center invested millions and millions of dollars and built one of the most beautiful nursing homes in our state. It's 45 beds, sitting 3 wings. The back deck overlooks the golf course and looks into the Bighorn Mountains. And they were running at almost full occupancy. Then the pandemic hit, and in the meantime, we built a VA nursing home up there, and now both of them are struggling. They can't get enough staff. I think that's what we're going to see happening, and maybe the market will adjust. Maybe the market will dictate whether or not we can do it. But that's one example. So as far as repealing the governmental exemption that already exists, it doesn't really matter to us because it already exists. The only one that I really have some concerns with is one, removing that mileage barrier, and secondly, I just think maybe looking at lowering the 85% down to a lower amount as far as the average occupancy in those areas, and let's see if it makes an impact. And maybe again, when we come back, if we do a sunset date, we can say, hey, that's the sweet spot. Maybe it worked, or maybe it didn't. Maybe we need to lower it. Maybe we need to get rid of it. I would just suggest maybe going to a lower percentage rate and see if it changes the market. And with that, I stand for any questions. Thank you.
Representative Ward.
Thank you, Mr. Chairman. Mr. Boley, wouldn't you agree that the staffing shortages you keep mentioning are due to the mandates that were imposed on healthcare workers in the last 2 years?
Mr. Boley.
Mr. Chairman, Representative Ward, I would say that it's part of the problem. I don't think it's the major part of the problem. I think the major part of the problem is we have an aging working population, an aging, especially in healthcare. We saw a lot of retirements in nurses. There are high wages being paid in areas that are more appealing to our young folks than being a CNA in long-term care. It's hard work. It's difficult to attach yourself to people that are there to pass away and spend the rest of their lives. I do think that some of the mandates may have had something to do with it, but I don't think it was the major driving force. I think we're just experiencing an aging population in our country.
Other questions? Seeing none. Thank you, Mr. Boley.
Thank you.
Mr. Crum, come on down.
Mr. Chairman and members of the committee, I'm Gary Crum from Laramie, Wyoming, and I'm here as myself and not representing any organization. Thanks again for hearing me last summer when we were over in Saratoga. And so I don't want to go through those details again, but I strongly would support repealing what I call a quasi monopoly with the 85% rule, the 30-mile rule. It doesn't lead to competition. I can speak without getting into the exact details, but directly about a facility in Laramie that wanted to start up a nursing home memory care facility and was unable to do that. That's roughly 5 to 10 years ago that took place, but they weren't able to do that because of this rule. And it's taken this long to kind of get where we're at today with this, but I'm passionate about, let the markets do what they do. We talk about Saratoga, and I think Saratoga is an example of what can take place. The nursing homes and care facilities do pay into a fund to take care of those who fail. I'm from the banking industry. We pay into a fund, the FDIC, to take care of those who fail. But the results in Saratoga were a win. right? The private community stepped up and built a facility to take care of the people in that community. And long-term, from my outside looking in and knowing the folks in Saratoga, I think it was a long-term win, actually, for that community. You know, I was in just a brief discussion this morning. I was working out at the Laramie Rec Center this morning, getting ready to come over here, and they didn't have any idea why I was coming over here. But the gentleman next to me was saying, I said something like, "How's your day going?" He goes, "Well, it's going to be a tough day. I've got to try to get mom and working with her up in Powell in a facility, and it's been a real problem trying to get them into a quality facility." So, you know, yes, there's beds available, but are they quality beds that we really would want us to go into? We're all probably going to have that opportunity one day, and or our parents or another relative to go into. So I would strongly support the repeal of that. Whether it's the new piece about whether approval or review of the documents prior to construction, I'll leave that up to you on that. I kind of like, you know, if a guy's in business, he ought to know what the rules are and be able to follow the rules, or maybe he shouldn't be doing what he's doing, but I'll leave that up to you. But again, I appreciate your time and would strongly support the repeal of this.
Questions, Mr. Crum? Seeing none, thanks.
Thank you.
Other public comment for or against the bill? Ms. Passano? Good to see you.
I'm glad to be here.
It's always a good day to be back at the Labor, Health and Social Services Committee. I think everyone here knows you were the former chairwoman of this committee not too long ago.
Quite a while ago. Good morning, Mr. Chairman and committee. I have a little bit of scratchy throat. I'm not lethal. I want you to know that. It's just there this morning. My first, I guess, point would be something that Mr. Crum just said about finding a quality facility, a SNF. And if we don't have quality facilities, we would all look to Ms. Hudspeth because she makes sure we are. Her staff are there for every survey that is taken. And if a facility is not quality, then we would know. Of course, they can't always be 100%, but I would like you to know that we had one this year that made 100%. Not many of us could do 100% in whatever job we have, but it is possible, and it has been done, and just recently. I am here to say that I believe that we can do something different with a certificate of need. However, I don't think we're at that point where we know enough of what would be touched if we did it right now. And I have not had a meeting with A&I, and that is the government place where we all go to see what are the statistics. And they're the ones that know how fast the senior population is growing. And Mr. Boley brought up many points that I would, the situation in Utah, everything that is a part of this particular point, this statute that is before you to be repealed. We do not have correct information on all of those fragments that are out there. One of the issues we have right now is we have the smallest population in the United States for a state. And that in turn has made it impossible to have enough work staff. And I'm not just talking about nurses. I have facilities that are still having trouble keeping housekeeping and the people to just work in the kitchen consistently. On the other hand, our facilities have people that have been there up to over 30 years. They're very happy to be there. They're a part of a community, and the nursing home is a part of that community, and they know the residents in that community. We haven't talked about those good points yet, and there are many of them. We're talking internally in the SNFs about changing language, and we've been doing that now for 3 years on a grant. And it makes a difference how you address certain things. Do we say it's our home and we believe it? Or is it just a facility where you just go? We're changing that language. And one of the facilities that is the most successful is in Lander. And actually, it has people, even short-term people, working there who choose to stay. And we are having a joint meeting with the Idaho Healthcare Association in April. And that individual has been chosen to go as we all get together, and they want to learn what the magic is with that. How is it? What are the conditions? And again, that facility is in the 3rd year of the change of how you speak about something. Do we say a toilet? Do you want a toilet? That is what has been happening over the years. Of course you don't. You don't say that in your home, and we're not saying that in a facility. It makes a big difference. I could go on and tell you all kinds of individual things that are happening that are good. And it is the Department of Health, Ms. Hudspeth and her crew, that tell us when we're not doing very well. And then we shape up and do that better. My suggestion is that we do lay this back. We do not do that without enough information, that we do bring in other people like A&I and tell us what is the future. And we do need to have certain things that we're all looking at in the next year or two to bring this back and make the changes that are actually going to be very helpful to the individuals who live in a nursing home, to a community, to staffing, to those who make it a life project. If we go too fast, what actually will happen? If we did it now and new buildings started to come, the staffing will go down for a brand new, beautiful place to be. And then Ms. Hudspeth will step in and will find there's not enough work staff, especially nurses, of course. We have to be careful what we're doing. We don't want bankruptcies that have happened in other states. Yes, that has happened. We need to know where the certificate of need has been taken away and what that experience is. Utah is the latest idea of what could be. I just, as a state that belongs to the American Healthcare Association, I know what's happening in other states. and just got some word from Oregon about what is happening there with the potential. Maybe we need to have some of those states come and come before you and speak about what would really make this work. We're all wanting to do the best we know how to do. I know you are too. And with that, if you all have a question.
And just for the record, Ms. Passano, if you could say who you represent.
Oh, sorry.
It's my fault.
Wyoming Healthcare Association.
And while I do have you, those are the, it's fair to say, for-profit nursing homes?
We have both
Do you?
nonprofit and I have one assisted living member.
Okay. Questions, committee? Representative Hornock.
Thanks for being here today. Every industry has staffing shortages, I would say. So this is no different. I'm just curious, do you think that a private company that comes in that wants to build any of these healthcare facilities that we're talking about, do you think they will take into consideration the ability to find staff to run that facility before they go through the process to figure out if this is viable or not for a construction project?
Representative Hornock, I would answer in this way. There are facilities that are stealing staff from each other. And as a matter of fact, it's not because we would like to have that happening. In one instance, one of the state facilities took a chief nurse from one of our private facilities. It has to do with pay and who can pay, who's paying the most, who can afford to do that. Not everyone has enough money at this point as we are post-COVID. COVID was a very hard 2 years, 3 years. We're coming out from under that now. But they're to stay viable. Every facility I know is having nurses come from other places, travelers. And we still are stealing from each other when we can afford to do so. And the number of beds that are in a nursing home and viable right now all depend on how much staff you have. The number of beds we can say we can have 65, 70, 80. But if they're not full, it's because they don't have enough staff. Thank you.
Thank you. Other questions? Ms. Passano? Not seeing any, Carol. Thank you very much for being here.
Very much.
Anyone else wish to speak on this bill? I can't get my Zoom pulled up, but there's one person isn't here on this bill, I'm guessing. Okay, going once. I guess I should say going twice. Okay, we'll close public comment. Committee, what is your pleasure on House Bill 24? Moved by Representative Ward, second by Representative Penn. And again, committee, Mr. Boley passed out an amendment. There's an amendment from LSO that was sent out that they believe there's a conflict in our statutes, and so LSO's recommended language, which has my name on it, is that we change healthcare facilities basically and just put in nursing care facilities. Have you seen this the director left that quick, huh? Oh, hi. You didn't want to sit in the front row. Have you seen this amendment from LSO or aware of it? Somebody, sure, come on back to the chair while you're that way, halfway up. I don't know if you can read it on the fly, but this is what our legislative services office said. We currently have a kind of a conflict in the law, which you alluded to, that what we are doing was too broad and expanded to all healthcare facilities. And really the intent of the bill draft, I think was on certificate of need repeals, but I'm not sure it was on all healthcare facility repeals or just on what we went into the interim was really with the understanding that it would be nursing homes. Any comment on that, Director?
Mr. Chairman, I do think this amendment looks to target that, review and approval specifically to nursing care facilities. Again, I would just offer that the section that it amends is not just dealing with certificate of need, but dealing with, preliminary construction plan reviews in the broader licensed healthcare facility world. I'd have to look at this in concert with how it would read in the bill. So apologies, but I would need a little bit more time to look at that. I was made aware of a draft amendment. I think it was mentioned earlier, passed out. I think Mr. Lindholm and Mr. Boley worked together, that from what I saw yesterday would also meet our needs. Mr. Chairman, sorry, that's what I have reading it on the fly for you.
Yeah, if you'd go back and we'll take some more we'll take some more discussion, and maybe if you do have any thoughts before the end of the discussion, let us know. Committee discussion on the bill, Representative Chadwick.
Thank you, Mr. Chairman. We've heard a lot of testimony for and against, all compelling. I think we've got more work to do. So in that light, I'm going to move to table. Through the interim.
Okay. Every day around here, there's stuff I don't see coming. It's great. So the motion is not necessarily, it's not debatable, but the motion being made by Representative Chadwick is to table the bill indefinitely and take it into the interim.
Yes.
You've heard the motion. All those in favor of that motion say aye.
Aye.
Does there need to be a second in a committee?
Motion needs to have a second.
Sure.
I'll second the motion.
Now that there's a second, all those in favor of the motion, please say aye.
Aye.
Opposed, say no.
No.
Let's see a show of hands. All those in favor of tabling it? Got 3. Sorry, Representative, I can't tell what this is. Everybody opposed? We are still discussing the bill.
Mr. Chair.
Representative Yin.
Mr. Chairman, I'll move the first part of the amendment that was offered to us where it puts back in approval, but makes it so it's restricted to the specific.
Would that be the LSO?
No, not the LSO amendment. I wouldn't do the Boley, Lindholm, et cetera amendment. Where it does allow approval, but it limits it to purposes of healthcare and safety compliance. I think that is actually a benefit for people who want to enter the industry and build new facilities because it doesn't create new costs for them when they get denied after they've started already working on it.
I will second that. Okay, it's been written second. Just because I have some questions, could I get both of you back up here? We'll kind of briefly allow some, not really public comment, but allow some questions to you. Just because I want to make sure I know who it came from and exactly what it's doing.
Mr. Chairman,
Representative Hornock.
can we be very specific about what piece of paper on what amendment we're?
It's, yep, it's the one with red at the top that isn't labeled on who it came from, which would be helpful, whoever this came from.
Mr. Chairman,
Representative Penn.
could I just make a clarification? Are we talking simply about the paragraph A and not the rest of it?
That is my motion, Mr. Chairman.
Thank you.
Yes.
It is not the repealers or the sunset, Representative Yen. It is just that first section, anything with red. Okay.
That's correct, Mr. Chairman.
Maybe I didn't need to bring you up here then, but let's talk while you're up here. What do you, just one more time for the edification of the committee, the hope in doing this amendment is?
Mr.
Mr. Lindholm.
Yeah, thank you, Mr. Chairman and members of the committee. The intent under this specific section, by putting approval back in and making sure that it's very specific about what that approval does, ensures that this is not a certificate of need approval that it's happening, is just for the purpose of approving health and safety types of codes that they already have to line up with. And I believe, without speaking for the Hospital Association, the hospitals themselves, that's what they were only concerned about, is that they still could check the box that they are required to under federal law.
Mr. Chairman, Yes, well, all healthcare facilities, because I'm also worried about nursing homes that may have new construction projects to add on. If this is repealed, they might want to put some new beds on. We just want to make sure they're in compliance before they start.
Mr. Chairman? And just one last thing, and I know this is semantics, but it is important, Mr. Chairman. Representative Yen had mentioned that this is the Bully Lindholm Amendment, and it's actually the Lindholm Bully Amendment.
It's a good thing it's Friday.
My apologies. Mr.
Okay, Net Representative Ward, question?
Thank you, Mr. Chairman. Mr. Lindholm, so given that it's your amendment, I can presume you're in support.
Mr. Chairman, and to Representative Ward's question, absolutely. I think this is a nice way to ensure that certificate of need is indeed repealed while ensuring that the hospitals are left whole.
And Mr. Bully, I know you were, I guess, lukewarm on the amendment as a whole, but somewhat supportive. Does it just having A meets your in support?
Mr. Chairman, I support that amendment. Yes.
Okay. Any other questions? Thanks for letting me call you back up here. Just stay, just in case. All right, on that amendment, all those in favor of the amendment, just A, LSO, so it's not the repealers and it's not making sure on the same page. All in favor of that amendment, say aye.
Aye.
Opposed, say no. Okay, that amendment is passed. Any other on this amendment you want to talk about while I have it in my hand and they're sitting up here? Representative Claston.
I'd like to add the amendment that we have LSO draft language that we put a 3-year sunset on this. So we can go back and look at this and make sure we don't have any unintended consequences that we're.
There's a second to that.
Second.
Seconded by Representative Chadwick. I'll just ask a philosophical question, then if anybody wants to jump in, including these two gentlemen, please do. We're basically, in my mind, then giving it a 2 or 4 year window. So if somebody wants to initiate a process, well, actually, we're still keeping the mileage. Okay, I'm warming up to it as I listen to myself speak. Thank you for that. Any other discussion on the repeal?
Mr. Chairman, I think the one benefit of making it 3 years is that we will hear it in a general session, which I am in favor of making sure that that happens.
Okay. Other discussion, Representative Hornock?
Mr. Chairman, so we've been through this in the interim. We talked about it in the interim. Some of these construction projects that we're talking about, the life cycle of the construction project is more than 3 years. And so from the time of a company, we lift this regulation, a company comes in and they say, hey, there's no more certificate of need, if I can say it right, in Wyoming, let's go build a facility. So they start the planning programming process. That takes a year. They have to get investors. That takes a year. Then they have to go and design the thing. That takes a year. Then they have to construct the thing and that takes a year. So I don't see a reason if we're trying to expand business, expand the ability in Wyoming for this to happen in the private industry, because we do have needs throughout the state that obviously are not being met at the moment by the way we currently regulate the industry, specifically with construction. And so I don't see a need for, a sunset in any way on this. I think if we open the door, let's open the door, and then then I think we're doing ourselves a big favor, because it takes a long time to get this stuff done. We can visit this in 10 years and figure out if this is working, but I don't think we'll come back in 3 years if we pass this and nobody will have a shovel in the ground to build a project, just because the planning and the whole aspect of doing that construction just hasn't even gotten off the ground yet. So it doesn't make sense to do this.
You want a friendly amendment for 10 years? Maybe. I mean, I'm open to anything. Based on those comments, I do believe there's some validity that 3 years, it might take a little bit of planning time, effort, and not that it's the end of the world with the language we currently have to, on what their approvals are going to be, but
9 years.
do you wish to amend your motion? Who made the motion? President Clouston? You still want 3 years?
I'm thinking 7. That's, I'm not sure I'll be here in 7 years. I might not be here next year, but.
We're the legislature. There's no such thing as a sunset. We can do anything we want.
While you're thinking about that, Representative Trujillo.
Thank you, Mr. Chair. Instead of setting a sunset date, why can't we just require reporting? And then we can look at the reporting as it's created.
Continued discussion on the amendment. Representative Penn.
Thank you, Mr. Chairman. I personally would say, I like the idea of Representative Trujillo. I think that if we're passing this, it's because we believe that it's going to be helpful and beneficial and it's going to work. And so I think that rather than say, let's pass something that we think is going to work, but let's come back and then have to say, yeah, we're going to continue it. Let's do it the opposite way. Let's say, let's put our trust in this and let's say this is going to work. And if it doesn't, then we come back and we amend as needed.
Technically, I think they're speaking against the motion for a sunset and put it into more of a report here in a time period. So on the sunset provision of 3 years is where we still are. Further discussion on that? All in favor of that amendment, please say aye.
Aye.
Apparently opposed, say no.
No.
That amendment's failed. Representative Yen.
Mr. Chairman, I would move to add a section requiring reporting on the result of the repeal of certificate of need by the Department of Health to the interim Joint Labor Health Committee for the interim for 4 years from now, so 2028.
Would you like to second that, Representative Trujillo, since he stole your thunder? Okay. Further discussion, not amendment. Representative Hornock.
Thank you, Mr. Chairman. Just against the amendment, just because we've talked about how tapped out staff is and stuff at the Department of Health. That's my only reason. The report might be valid, but yeah, let the free market ride.
And we appreciate the report we got this week, Director Johansson. I'm sure all of my committee members read it. I think we got that last Thursday in one of our statutorily required reports to this committee. All right, on the report in 4 years, further discussion. Seeing none, all those in favor of the amendment, say aye.
Aye.
Or opposed, say no.
No.
Show of hands, all those in favor of the amendment, raise your hand. 1, 2, 3, 4, 5. We're gonna get a report here in 4 years, if that stays in. Further amendments or just discussion on the bill? I think if no one's gonna move you those, I'll let you off the hot seats, but thank you for staying. Question being called and seeing no further discussion or amendments forthcoming. Barb, if you'd call the roll on House Bill 24.
Representative Chadwick. Representative Clouston.
Aye.
Representative Hornock.
Aye.
Representative O'Hearn.
Aye.
Representative Penn.
Aye.
Representative Trujillo.
Aye.
Representative Ward.
Aye.
Vice Chairman Yen.
Aye.
Chairman Swanitzer.
Aye.
9 ayes.
We're 3 for 3, committee. Anybody want to carry House Bill 24 on the floor? Representative Ward, it is all yours. Could be up as, well, I highly doubt it's coming up today with everything we have going on. Next bill for our consideration is House Bill 25, Medicaid third-party payer conditions. This was brought, thank you all very much for being here. If you don't want to stick around for third-party payer conditions, we understand. We'll give it 30 seconds to clear the room. This bill was brought in the interim, I do believe, from the Department of Health. And committee, you'll probably remember we were running late one of those days. And so I think we probably took less, than 2 minutes of testimony, said it made sense, it was good, and passed it through, saying we'd talk about it more in 6 months. And here we are. So a quick refresher, if you would, Director or State Medicaid Agent, on what the legislation is doing, why it's needed, et cetera.
Thank you,
Welcome.
Mr. Chairman. Members of the committee, again, Stephen Johansson with the Department of Health, joined by Lee Grossman, our state Medicaid agent. This bill, just by quick way of introduction, I'll hand it over to Lee. Really kind of a cleanup bill to ensure that Medicaid in its functions to make sure that what we call third-party liability or other pay sources that we identify as having a requirement to pay for a member's services, that we are able to leverage those pay sources in a way that makes sense to protect the taxpayer dollar here in Wyoming. So there's just a few, you can see on page 2 of the bill, just a few best practices that are in there, timelines, somewhat similar to your prior authorization discussion in the insurance code from a couple of days ago. Similar kind of provision here to ensure that third-party policies, timelines aren't preventing the state from its necessary and fiduciary duty to collect from third parties when they are essentially owing a payment for a service that's rendered. With that, Mr. Chairman, again, you're right. The discussion was quick at our meeting in Saratoga, but I'll hand it over to Mr. Grossman to provide some additional detail and maybe an example of when this comes into play.
If you do all that, please, Mr. Grossman, welcome.
Good morning, Mr. Chairman, members of the committee, Lee Grossman, State Medicaid Agent. Really just the only thing I would add to the director's comments are illustrating an example. So let's say Medicaid pays a claim for an individual. Later, we find out that they have commercial coverage, employer-sponsored coverage, if you will. We would then seek, again, to make sure that Medicaid is the payer of last resort. We would then bill that insurance carrier in terms of recovering that money. So this is, again, just saying that if Medicaid does not get a prior authorization from that carrier, they still are obligated to repay Medicaid those funds and establishing that 60-day timeline in terms of responding to any inquiry. So with that, from our perspective, best practice and a pretty simple bill to make sure that we're protecting taxpayer dollars here.
Representative Clouston.
Thank you, Mr. Chairman. Fully in favor of this. I do have a question as far as healthcare provider was given Medicaid information, bills Medicaid, Medicaid finds out, they have another health insurance policy. Can the healthcare provider then go back to that insurance carrier and say, instead of being paid Medicaid rates, you also owe me what our contractual obligation with you was for this private insurance?
Go ahead.
Mr. Chairman, Representative Clouston. So the process, the short answer is yes. The process by which that could happen, depending on, of course, how long that's occurred, would be for the provider to void the claim that they sent into Medicaid and then bill that commercial carrier. So just trying to keep it really simple. Yeah, that could happen.
Does that normally take longer than 60 days? Or you talk a little bit more why we're putting, I seem to remember some type of federal requirement or states are moving this way. Remind me on the 60 days.
Mr. Chairman, so that 60 days isn't necessarily in terms of responding to a claim. That's if we're looking to just verify any information. So just very, very broad, really, from that perspective.
But is that a national standard being put on us? Or is that just, we thought 60 days seemed like, we can normally do it in 30, but we want the window?
Mr. Chairman, yes, that would allow us to comply with federal requirements as well.
Other questions for the Department of Health or the state Medicaid office, which is still part of the Department of Health, but sometimes is somewhat individualistic. All right, seeing none. Other people wish to speak on for or against House Bill 25. What, you're all here for the other one, huh? All right. Nobody on Zoom. Mr. Pearson is hanging out. All right, moved by Representative O'Hearn, who's going to get the floor management if it passes. Second by Representative Chadwick. Unless the second wants it. All right, bill has been moved and seconded. Discussion, Representative Trujillo.
Oh, no.
Any discussion or amendments, committee? Seeing none. Barb, if you call the roll on House Bill 25.
Representative Chadwick. Representative Clouston.
Aye.
Representative Warnock,
No.
Representative O'Hearn,
Aye.
Representative Penn,
No.
Representative Trujillo,
Aye.
Representative Ward,
No.
Representative Yin,
Aye.
Chairman Swanitzer.
Aye.
6 aye, 3 no. Do pass.
Representative O'Hearn, do you want that one on the floor? Okay,
Mr. Chairman.
Representative Yin.
So we spent 90 minutes, I think, on the first bill. And I think this third bill actually will probably have quite a bit of public comment. So given that we only have 20 minutes left before we have to go into session, will we move this one to the next meeting?
By a show of hands, how many people are here to speak on House Bill 44? 2. Well, maybe we'll 3 plus assumedly the department. Let's kick it off. We'll see how far we get if that works, committee. Unless, sure. House Bill 44, parental rights in a minor child's health care. This was voted on at our 3rd interim committee meeting. And I think it was actually brought by Representative Ward as an individual bill that we discussed and made into a committee bill. So Representative Ward, do you want to just remind the committee what the bill does?
Sure, Mr. Chairman. Is it okay to do it from here?
Yeah.
Okay. So this bill gives rights back to parents to be able to see their children's online healthcare records. A constituent came to me very upset. I believe their daughter had turned 12 and they got a notice from the hospital that they could no longer access their children's online healthcare records because of the well, this is one influencing law, the law that allows minor children at 12 to get treatment for tobacco cessation without the knowledge of their parents. Also, there are other laws involved with this kind of thing. And the second one in this bill is about that a minor can be vaccinated during a public health emergency without consent from their parents. And that's why this bill is parental rights in minor child's health care.
Any opening discussion from the committee? I know we heard it in interim. Seeing none, maybe we'll open it up to state agencies first. We did just have 3 of them join us, but do you have any comments or thoughts, Director? Okay. Seeing none, Governor's office, same. Seeing no agencies, I assume if the director isn't wanting to speak, you're also here for listening. All right, hospitals or medical society, which one wants to go first? You can come up together too, actually, if you'd like. We're all still getting along from prior auth, I think, so let's keep it going. Welcome, whoever wants to go first.
Mr. Chairman, members of the committee, Sheila Bush with the Wyoming Medical Society. The Medical Society establishes our policy platforms on a few key tenets, and the first of those is access to care. And the way we read this bill, it directly impacts the ability for patients to access care. And for that reason, we're opposed. I think it's important when you consider or contemplate repealing statute to know more context about why the statute was put in language in the first place. And so with a little bit of indulgence, I'd like to give the history on both of these. Thanks. So it repeals 2 sections of statute in very different parts of statute. The first that I'd like to talk about is 34.3.113. So if you look in statute, this was adopted by the legislature in 2003. After a 2002 interim committee, the Joint Transportation Committee took up comprehensive public health reform in response to 9/11. The Transportation Committee. And so a lot of work in 2002 went into establishing all of the public health statutes, and it was in direct response to fears of future terrorist attacks, mass casualty events, and tragedies. And so if you really look at 35.113 and the language, it's about medical treatment without consent. And so if we go back to where America was in 2002 and 2003, we were deeply fearful of similar events to 9/11 and a situation in which parents might be not available for very tragic reasons, and a child would be left suffering the languages, suffering from disease, death, disability, or suffering. And so I think that's pretty broad and speaks to in a public health emergency, if the public health officer believes that a child is in need, this statute gives them the ability to deliver care to a child who is suffering. And so to repeal that really makes the statement that we don't want the ability to take care of children who are suffering in need. And so I recognize in the presentation that the word vaccination is in there, and that seems to be obviously a hot topic right now. But this is far broader than vaccinating a child. And so I think it's important to be in the mindset of 2002 and 2003. Also, the risk that still is ever present in our country, and be really careful about what we strip out of our statutes in rights of taking care of kids. The second
Can I just
repeal.
stop you? So, I mean, going along those lines, we're thinking things like an anthrax or a chemical warfare attack is why you would need some type of an immediate vaccination of the populace in some type of warfare attack. Is that, I just wanted to make sure I'm understanding where you're going.
Mr. Chairman, yes, but also I think it's also just medical treatment. It says, what we're repealing says during a public health emergency, the state health officer may subject a person to vaccination or medical treatment without consent in the following circumstances. If the parent, legal guardian, or other adult person authorized to consent to medical treatment of a minor child cannot be located and consulted, and the vaccination or medical treatment for the minor child is reasonably needed to protect the public or protect the child from disease, death, disability, or suffering. So yes, Mr. Chairman, I think you're correct in terms of communicable disease, anthrax, et cetera. I think you're also talking about mass casualty events.
Sure. Yep. Question, ripped on the board.
Thank you, Mr. Chairman. So here's a proposal, which might be friendly, if we just removed "and the vaccination of" and the vaccination of in paragraph I and paragraph II. The part would remain to be able to treat children in a disaster or emergency. Yeah.
Bush would.
Mr. Chairman, I appreciate the intent. I think that there are situations in which a vaccination would be helpful. Not everything where we are today is about COVID. These statutes reach far beyond the most recent pandemic. And I think we need to be really careful to not get too narrowly focused or tunnel visioned on one specific disease. I think the ones that you mentioned are fair. Anthrax, any sort of future terrorist attack or chemical warfare that could be coming that we aren't aware of. I think it's really hard to say that we're positive there would never be a situation in which that would be needed. I would also offer that the legislature has done a lot of work around establishing public health emergencies, the authority of the legislature to confirm or ratify those public health emergencies. And so that might be the more appropriate mechanism because these are specific to once a public health emergency is established and then the authority of the public health officer to protect those children. The second repealer, should I continue?
Did you have follow-up? Follow-up? Go ahead, ripped on the board.
Thank you, Mr. Chairman. Ms. Bush, wouldn't you agree that parents should be able to consent to any vaccination that their child could receive?
Mr. Chairman.
Ms. Bush.
The statute's pretty specific to the parents not being able to be found or located. And so I think when we talk about public health emergencies, and again, we think back to 9/11, you had thousands of families impacted by the deaths of the two towers being attacked. And if those parents can't be found, those children still need care. And so I would continue to believe that repealing that is maybe a little misguided. The second repealer,
Representative Trujillo, question?
Yes, I have. Thank you, Mr. Chair.
On the
Quick
first one.
question. How does the system currently deal with families who don't believe in vaccinations due to their religion? Would you automatically give those children vaccinations against their religion and family beliefs?
Ms. Bush?
Mr. Chairman, the system has a number of different ways that families can express exemption, religion being one of those, and those would still stand. Those would be documented and honored.
But in this case, if you couldn't find the parents and if you don't find the parents, you have a 6-year-old, you're not gonna know what the religious beliefs are. But let's say it's a 14-year-old and they say, hey, I don't want to mention a specific religion, but they're of the faith that says we don't partake. What would happen that minors care? They'd be vaccinated against their will or cared for against their will?
Mr. Chairman, I'm not sure what cared for against my will would look like. I'm sure that there are others who can provide examples. It's my understanding that when an exemption for a vaccination is requested, that's documented and lives on file with the Department of Health and other places, schools, et cetera. And so I would imagine that can be found. It's not a verbal consent every single time a new vaccine is up, right? When you are granted an exemption, and I think I would defer to Representative Penn, you probably know better. But it's my understanding that that's a formal request that's made through a variety of forms and documents, and those live in archived ways and could be found.
Technically, is it a question? Go ahead, Representative Penn.
Yes, thank you, Mr. Chairman. So just to offer a bit of, I do have a question, but just to offer a bit of clarification, yes and no. So there is a state database that can be accessed to look at immunization records. Does it say exemption in there? No, I don't think that it does. Sometimes if it's a note written on a chart somewhere, and so that can be a little bit difficult. But I think in this situation, once again, we're talking about vaccination, we're talking about emergency situations. And so, most vaccinations, you don't get protection from a vaccination for usually a couple of weeks. And so when we, the instance given is 9/11, I just can't foresee a situation where we need an emergent immunization. And even still, I mean, I think this is a parental rights issue. And so would you agree?
Now, these questions, yep. Ms. Bush.
Mr. Chairman, I think it's difficult to contemplate today all of the potential things of the future. I think that the world is moving quickly. I think that we are facing challenges that we wouldn't have dreamed of 10 years ago. And I think the same will be true in 10 years when we look back on today. And so I would hate to make a decision today that we deeply regret in the future because something is available, whether that's to combat a chemical warfare or any of those kind of situations. I'd hate to really question the decisions made today because we just didn't know to think of them.
And you might not know the answer to this because I don't. Is a tetanus shot considered a vaccination? I mean, I can see that being an immediate and within 24 hours, 12 hours,
Mr. Chairman, yes, I do believe tetanus is considered a vaccination.
And I'm sure if I try, I could think of maybe some other ones, but that was the one that came to mind. All right, okay. Question, Representative Hornock, never mind.
Mr. Chairman. I understand there's some complications around this, but can you think of a specific example? Because we can go through hypotheticals. We can go through, maybe on 9/11. Maybe this happens someday. Maybe 10 years in the future, this would happen. Is there any specific example where not having this specific bullet point in state statute has resulted in the detrimental health care of a child?
If you know off the top of your head, Ms. Bush.
Mr. Chairman, I do not unfortunately have a compendium of all history of health in my head. I can try and find one and work with them. I'm certain that it exists. I don't question that.
Good news is we're not going to get through the whole bill today, so we have the weekend.
Oh, thank you.
On You'll,
I
and other
really
people
appreciate
behind you
that.
will have the weekend as well. Representative Eden, you have a question?
Yeah, thank you, Mr. Chairman. So, I think something that I read in high school actually is coming back to me, where I read a book about, I think it was the hot zone, where the Marburg virus or Ebola is something that occasionally runs rampant in outbreaks in Africa. And there was a situation in the eastern seaboard somewhere where there could have been an outbreak. Is this a situation where you have a fast-moving, super deadly virus where basically if you get it, you will die? If there was a vaccination for that, it would be a case where it makes sense to do it sooner rather than later.
Mr.
Bush?
Chairman, yes, I think it's a perfect example among others.
I also read the hot zone in high school. Representative Clouston, and then we'll let Ms. Bush finish her comments, but we're gonna end it there. So you get to stay on the hot seat, but hospitals,
Can you
Need to
just
wait.
stay because it's fun? I like this group testimony thing.
they're fun. Representative Clouston.
Thank you, Mr. Chairman. Thoughts on this? Vaccinations and medical treatment in emergencies is a huge, sudden problem. Looking at smoking cessation, which is an ongoing issue of something that's happening daily, happening currently, right? I mean, these are two completely different situations. Representative Ward had mentioned that a person could not access their online medical records. Could they go to the hospital and get those records?
Ms. Bush, if you know.
Mr. Chairman, yes.
We'll let you, I know you had some other thoughts to get through.
Sure.
And then we'll get through those and maybe we'll call it good. Go ahead, Ms. Bush.
Great. So the second repealer in this is the tobacco cessation component found again in a completely different part of statute. This is under the emancipation statute. This was passed in 2009. And interestingly, and I think because history is great, the fine Chairman Zwanitzer was a co-sponsor on that bill. So maybe you have more context and history to give us about that if you can remember back to 2009.
We wanted to help youth quit smoking, as we still do today, I think, in my mind.
Correct.
But I did. That was the Senator Sessions bill, wasn't it?
It was.
I think my good senator encouraged me to be the House sponsor on that, yes.
Yeah.
Go ahead.
So the Medical Society would oppose repealing this as well. We think that any pathway to someone finding an ability to quit a very dangerous and addictive substance is a good thing. And so putting a barrier in for someone to not get help, it doesn't seem to track with the intent of a society in general, I think, to not have kids addicted to tobacco or other substances. And so there are a variety of situations that you can imagine. If there's a teen or an adolescent who has obtained cigarettes or a vape pen or whatever is available without their parents' knowledge, and they've gotten addicted, and then they recognize in themselves that they have a problem and they need help. I can't imagine a world where we would want them to not be able to seek help because they might fear retribution from their parents. If their parents never knew they had gotten that vape pen from a friend in school, and then they recognize a problem and want to address it, yes, in a utopia, we hope that the family life is a really good one and it's the one that all of us grew up in and share. That's not the case for all kids. And so I would want any teen to be able to honor the relationship they establish with their care provider and go talk to a person they trust and say, I really need help. I got in trouble. I'm in over my head. I don't want to vape anymore. This is scary. Can you provide therapy, counseling, medications? Can you do those things? But if you do, I'm going to go home and if my parents find out, they'll beat me or there's abusive fear at home. I think that it's really sad to contemplate putting a barrier up for those kids to get the help that they need when the end goal really is for them to not be addicted to tobacco.
So thank you for that. The bad news is it looks like you have at least two questions up here coming at you, but we might have to keep you on the hot seat on Monday when we carry this bill over to 8 a.m. Monday. Barb, and with that, committee, please try to make it to the floor in the next 2 minutes before roll call if you can. Thank you for giving us some stuff to think about over the weekend and maybe some potential amendments we might want to explore as we move forward. We will be adjourned.